Hello, everyone, and welcome to today's Caregivers Talk. I apologize that I can't hear what anybody's saying, but I'm assured that you can hear me. So, our Caregiver Talks are sponsored by AARP Kansas City, and we're so grateful for their ongoing support. And we're grateful that you're here, whether tuning in live or catching the replay. I'm Diana, and I'll be your host. I'm on the board of Sandwich KC. We're a 501c3 nonprofit helping family caregivers in Kansas City metro area by providing free information and referral support groups, education, and self-care activities. Sandwich was founded in 2018, and we've been supporting family caregivers around town ever since. You can visit us online at sandwichkc.com to find more news about how we support family caregivers. Be sure to sign up for the weekly newsletter because Rachel sends out all kinds of fun links. I'm so glad you've taken time out of your busy caregiving day to be here. As caregivers, helping our loved ones manage their health care and coverage becomes one of our responsibilities. Today, we'll hear about Medicare, how it works, what it covers, and important considerations as open enrollment is just around the corner next Wednesday. We'll be joined by Erin Wilson. Erin is the regional liaison for the Kansas City Metro Northeast Missouri region of Missouri SHIP. SHIP program certified by the federal and state government to provide free, unbiased, and confidential private Medicare services. SHIPs are not insurance companies. Many are housed within government or nonprofit agencies, and they do not sell anything or charge for their services. So, hi, Erin. How are you today?
Hello. Thank you, Diana. I'm doing very well. Happy to be here. And thank you, Ashley, for joining. And hopefully everyone else that gets to listen to the recording will appreciate and gain something from my presentation.
Well, thanks for joining us today as our local expert, and we look forward to learning about Medicare from you.
Absolutely. Okay, so I'm going to share my screen.
Just kind of signal to me when you're finished.
Okay. Ashley, can you see the presentation?
I'm not seeing anything right now.
Okay, let me go. How about now?
Okay, now it's popped up.
Okay, perfect. Okay.
Nice.
Let me see. I got to make sure that I have it in the right display. Okay, so as Diana mentioned, I am Erin Wilson. I'm the regional liaison for KC Metro in Northwest Missouri. So I cover a pretty large area, but I obviously don't do that by myself. I have several partnerships and lots of volunteers that have been trained through SHIP to provide unbiased counseling for Medicare beneficiaries. So today we're going to talk about who is Missouri SHIP. And as Diana said, we are the State Health Insurance Assistance Program. We have trained counselors that provide free, unbiased advocacy, education, and assistance to Missourians with Medicare and those who help them make informed decisions about their health insurance needs. So in your case, you might be caregiving for someone who has Medicare and needs your help in making some of those decisions or, the guidance with that. We were created by Congress in 1993. Again, providing Medicare education and assistance, answering any questions, providing any resources that we can to beneficiaries, caregivers, providers, anyone that contacts us at that 800 number. We also provide feedback on state and local problems to CMS, and my director is in constant communication with Jeff City and Washington, D.C. And as Diana mentioned, we do not sell or promote any insurance company or its products. So we're simply a resource, unbiased, again, to help the beneficiary make a informed decision. This is kind of a funny one. What's the answer to most Medicare questions? It depends because Medicare is so complex. And so there's lots of different variations when it comes to Medicare. This slide kind of goes over what Missouri SHIP counselors do. And so you can see there that they represent Missouri SHIP at outreach events, booths, health fairs, senior events, community events. You might see us, at any of those events with information and just trying to spread the word about what we do and who we are. Counselors promote the Missouri SHIP program. So again, at those booths, maybe they go into their pharmacy and they might tell their pharmacist, what we do and offer that as well. Education, they can offer the Medicare 101 group education presentations, similar to this one. This is a little shorter than the Medicare 101. We have several other presentations that we offer as well. Counselors are also recruiters, and so they might recruit and mentor new volunteers. Counseling, obviously offering one-on-one counseling by phone, face-to-face, virtual in the community, and at counseling sites. And then enrolling. So our counselors are trained and can assist with Medicare enrollment and provide financial assistance program screening and enrollment into those programs as well. So those are a few of the things that our counselors do. Again, it's such a complex topic that there might be even more things that we can do as well. This just kind of goes over again, like how Missouri SHIP counselors can help, enrollment and billing. So somebody may need, maybe new to Medicare and want to just go over what do I do? How do I start that process? Call us. We'll be happy to go over that with you and explain that to you. We get lots of calls for clients who have billing issues, like things that maybe were coded the wrong way. We can help with those things. The Medigap supplement insurance plans, we do offer assistance with those. We have the Department of Commerce and Insurance is our guide on that. And we do also use the Medicare.gov plan finder to assist with that as well. The Medicare Advantage plans, we can help you shop around for those and look for the best one. Same with the Medicare prescription drug plans. And then the public benefits screening. So if a counselor is talking with a client and feels like that client is likely eligible for one of those say public benefits, we would do a screening. And if we find it necessary, we would go ahead and encourage the Medicare Savings Program in an application or the low income subsidy applications, Medicare Part D extra help, any of those things to just assist the client even further. A lot of times clients don't know that those programs even exist, and they have been income qualified for quite a while and they've just been missing out. So we do our best to try to make sure that we inform all of our clients of those things. Appeals and grievances, we can help with those. A lot of times people don't even realize that that's something that we can do, but we work directly with CMS and Medicare to work through any of those appeals or grievances. And then lastly, suspected waste, fraud, and abuse. And those are things that we can help with too. And we do a lot of partnership with Senior Medicare Patrol, so we can also reach out to them if it's something that we're not sure about, and they have hands on deck as far as that goes. So, and Ashley, if you have any questions at any given time, you can speak up, or I can do Q&A at the end also.
Okay, sounds good.
Why is the best advice call Missouri SHIP? Because of the complexity, and I kind of already mentioned that, but it really is, Medicare is not black and white. I mean, there's so many different avenues and so many different things that you have to think about whenever, you're signing up. So call us and we can help you through that process. Here are some important dates. So Medicare general enrollment period begins January 1st and March 31st. And that's a time to take a second look at your Medicare Advantage plan. So if you're in an Advantage plan, you have that period. So let's say you joined an Advantage plan during open enrollment from October to December, which we're about to approach. You find out in January that the plan that you signed up for is not what you thought it was going to be, and maybe you went to the doctor and they don't accept your plan. You have the ability from January to March to look at that and return to original Medicare and add a Part D plan. So that's a very important one. And then October 15th to December 7th, which is less than a week out, is a time for you to review your current coverage, make sure that you're not overpaying, make sure that you're still getting the best coverage, make sure that your insurance is going to be accepted at the pharmacy that you're using. And then if not, then we can assist you with enrolling in a different plan, changing the plan that you currently have. And you can do that with your drug plan and also your Medicare Advantage plan. And then you can see in red, there is no annual open enrollment for Medigaps. The Medigap policies, you sign up for that either at your 65th birthday if you go down the original Medicare avenue, or if you're still working at 65 and you're covered under your employer's benefits. Once that no longer is the case, then you would have a special enrollment period to sign up for your Medigap policy at that time. And then Missouri is one of the states that does have an anniversary date for Medigap. So every year, around the date that you initially sign up for your Medigap policy, you can review that policy, make sure that it's not costing you too much, making sure that you're still getting the best bang for your buck. That would be a time for you to do that. And not all states offer that. So it is nice that Missouri does. This slide just talks about how Missouri SHIP is different. Our services are free to clients. That's my favorite part of this whole thing. We don't charge for you to call us and for us to spend an hour, 2 hours, 20 minutes, doesn't matter. It could be a simple question, but we are not charging you. And why not call us if you have the question? Let us help you. I don't claim to be an expert, but we are trained and we do keep up on all things. So ideally, we are the experts when it comes to Medicare. We are not insurance providers and we're not selling anything. So sometimes people are under the impression that we are making money off of our counseling and our offering of information, and we are not. We are a federal program. And I mentioned earlier, our program is administered by Missouri Department of Commerce and Insurance. And again, we are bound to provide unbiased counseling. We help individuals make informed decisions. And we've been doing this since 1993. And we're also a nonprofit organization, just like Sandwich KC. This slide is just for those people that might be interested in becoming a counselor or becoming a part of Missouri SHIP. And so if you felt the need for a partnership or you felt like that might be something you're interested in, you can visit our website at www.missouriship.org to learn how to become a volunteer or a partner with Missouri SHIP, and then find out all the details about counseling and other volunteer opportunities. And our number for anyone to call, whether you're looking for help or if you're needing materials or you simply have a question, you can call the 800-390-3330 and you will reach our contact center in Columbia, Missouri, and they would send that out to the appropriate area of the state and someone would reach out to you. When should I contact Missouri Ship? We kind of talked about this already, and there's that number again. These are just a few out of the big pile of reasons. When you're turning 65, if you have SSDI disability and you've been on that for 24 months, on the 25th month, you are eligible for Medicare. So call us. Medicaid or Marketplace ending, and you're transitioning from Medicaid or Marketplace to Medicare, that's a good time to call us. Obviously for open enrollment period, employment coverage ending, we get a lot of those questions. If you just want a Medicare 101 presentation or any of our presentations, contact us. And then, like I had mentioned earlier, if you're just needing Missouri Ship resources, you can contact us and call that 800-390-3330. I didn't go into a lot of detail about open enrollment, but I will add, because that was the main bulk of the presentation. So I will talk a little bit about open enrollment now, and this is just impromptu. October 15th to December 7th, are the dates that you need to note on your calendar. And those, we advise any beneficiary to talk to someone, review your plan. I tell all my clients to go to medicare.gov, create an account if you haven't already, add your drugs in there. And then, if you're confident seeking the website out yourself, go for it. If you're not, call us and we'll be happy to walk you through that process. We all use that tool to do plan comparisons. And when I say plan comparison, I mean, it'll pull up your current plan, and then we will look at the plans for 2026 to see what plan is going to be best for you, given the drugs that you're on, the pharmacy that you use, etc. And we can look at Medicare Advantage plans. We can look at the special needs plans. We can look at all of it. We can look at Medicare or the Medigap policies as well. So, and we can even do the enrollment for you. And we don't have to have an in-person meeting. If somebody requests an in-person meeting, we're happy to make that happen. But we found, mostly during COVID, but we found that all of these counseling sessions can be completed over the phone. And with email and things like that, it's really easy to grab med lists to put in there. So I'm trying to think. That's the main bulk of open enrollment. And really, guys, if you're not sure, call us, because we do it all the time and we're very seasoned in doing it, even creating the accounts on Medicare.gov. Sometimes people just are afraid or shy away from doing any of it because it's too much of a headache, or they're not tech savvy and they don't want to use the computer. We got your back when it comes to that. Like, we will help you through that process. It's not hard for us. It's very simple. We share your account information with you. Obviously, it's your account. So do not hesitate to call us during October, from October to December. Anytime, call us, but especially during open enrollment, because it's a very, it's a sensitive time for you to review your benefits to make sure that you're getting the best coverage and you're paying, a good price for the coverage that you're receiving. And I will add too, Diana and I were talking before the meeting, before she lost her ability to hear me. We were talking about a couple of the plans not being accepted, United Healthcare and Aetna. So it's really, really important that you check into your plan to make sure that what you have is going to be accepted at those places that you're going. The doctor's office, the hospital. If you have an Advantage plan and you're using the dental coverage, like, make sure that your dentist is covered. Same with your eye doctor. If you're getting hearing exams, all of those things, make sure that you're reviewing and checking into those things, because once December passes, unless you are on an Advantage plan, then you have the January to March period. But really, October to December is your time to seek out and make sure that you're paying the best price. So, I think that I covered everything that I had planned to cover. Ashley, do you have any questions for me?
I think my only question is like, if somebody knows absolutely nothing about Medicare, like, so calling this would be like a good resource to even explain like the basic plans.
Absolutely. Yeah. And we can even go so far as to explain what is original Medicare, what is Medicare Part A, what does that cover, what is B, what does that cover, what is the D, what is your Medigap, like what does a Medicare Advantage plan do, and just explain all of it to you. So yes, don't definitely call us because we can give you all of that information.
Okay, awesome. Thank you so much. This is like a really valuable resource that I had no idea about.
Okay, awesome. I'm so glad that you were here today.
Yeah, absolutely.
Rachel, can you hear me? Oh, she has a question.
Hi.
Hello.
I was late joining. Sorry. I do have a question. So,
Yeah.
and it's not really like enrollment related or anything. I was wondering, what advice do you have, like for me with my grandma? I was her power of attorney, and she had Alzheimer's. What advice do you have for somebody like that who is, you know, not the person themselves? Are you following me? Like,
Yeah. Yep.
uh-huh.
Yep. I mean, if you're, I had the same thing with my granny several years ago. She was just really confused and didn't know, like she knew she needed the coverage, but she didn't know what she had or what, why she needed it. So, I always just helped her through that, and I just always did like a plan comparison for her every October to December to make sure that she had the right thing. And here's the other thing, like we ran into a couple scenarios with her where when I was working, she was home, she would get phone calls, and one time her meds, like her plan got changed. Not the plan, excuse me. It was the pharmacy. They switched her to mail order, and I was filling all of her medications at the pharmacy that I worked at the time. And it was a nightmare. And it was simply just because she had said yes on the phone. And so that's all it takes for those. It's crazy, but yeah.
Oh my gosh, I know exactly what you're talking about because back in my days of taking care of grandma, uh she had somebody call and she completely changed everything about her Medicare. And I was like, oh grandma,
Yeah.
why?
Yes.
Oh
Yeah.
brother. So oh gosh. Well, uh, that was my only question. Is there any other questions from anybody?
I know Ashley, I already answered her question, I think. I mean, unless she has anything else. And Diana, we were talking and chit-chatting, and then all of a sudden, like she couldn't,
It's okay.
like I can hear her, but she can't hear me. So
Uh well, so we can. I'm looking for. So we can go ahead and wrap it up then.
yeah, that's
So
fine.
well, thank you so much, Erin, for
Yeah.
sharing your wisdom and
Yeah.
teaching us about SHIP today. I think it's so, just like Ashley said, it's like
She
nobody
didn't know
knows
about us.
about this wonderful resource, and we're doing all we can to make sure people do. But anyways,
Yeah, no, thank you guys for having me. And as always, anytime you want a presentation, if you're ever needing something in person, let me know. Like if you're having an event or something, or you want us to set up a booth, like we're
mhm.
happy to do that. So
Okay, great. That's awesome. So
yeah.
everybody, thank you for joining us today. We
Yes.
hope you can join us next month on November 14th at noon for a free practical talk with Tina Parsley Hughes from Lighthouse Legal KC, who will share the basics of estate planning for an aging parent, spouse, or other loved one. And thanks again to AARP Kansas City for sponsoring this series. Have a great day, everyone, and take care.